If you can just state your full name and your title, that would be great.
I'm Dr. Jennifer Shu, and I am a pediatrician in Atlanta, Georgia. I'm also co-author of Heading Home with Your Newborn.
Great. Well, thanks for meeting with me. So tell us about your book. I mean, I've seen it. I haven't read it because I don't have newborns anymore. But maybe tell me a little bit about that. That's interesting.
Yeah, so my co-author and I wrote a book specifically for the newborn period because this is such a time of transition for most parents. We really wanted to kind of instill some confidence and give them some reassurance with some medical backing to it. There's so many, new parent books out there that are written by non-pediatricians that when I had my first child, I really felt like there was a need to have something that was written by doctors, but also very relatable to parents.
So what are the kind of highlights of your book? Like, what are the big points that you try to, because I assume it's kind of like what to expect when you're expecting, but related to pediatrics. So what are the kind of big, things that you found that, that you've tried to demystify as far as being a new parent?
So it's pretty much everything that your pediatrician would tell you at the very first visit or even at the prenatal visit, what to expect once you go into the hospital and have the baby, what they're going to do for the baby and how they check the baby, as well as what you're going to need to know for those first few months. And that would include things like doctor's visits and immunizations and car seats and bathing and clothing and just, how to take care of all the body parts. So it's a very basic primer. And our goal was really to make sure parents could build that confidence in their own parenting skills and then just kind of reassure them along the way. We try to make it really user-friendly and readable too. And so there's some corny jokes thrown in here and there.
Well, that's part of being a parent is being corny, I think.
Yeah.
So have you gotten any feedback? I mean, the book's been out for a while now. I mean, are there things that like people have reached out to you and said, oh, this really helped and this changed my life? Or how, have you thought about adding this or that topic to the book?
We're about to put out our fourth edition. I believe that'll be coming out this fall.
No.
But I've gotten a lot of feedback saying that parents really love the fact that it was informative but not judgmental. And they found that to be, very nice because parents are so much, they're so judged in general by everyone around them, and maybe not necessarily judged, but you get all this advice from different people and you don't know what to do with it. And we basically tell them that there are many right ways to parent a child, and you have to kind of take all the information that you can find from a medical standpoint and then make that work for your family.
Got it. And so in that book, my goal, I mean, as a pediatric ENT, I deal with boogers and earwax and all that. Do you guys kind of discuss your baby's first cold and what to do? And
we do that. We talk about pee and poop and spit up and
nice.
stuffy noses. So pretty much the same thing.
Well, good. Yeah. Well, tell me a little bit, like what is your book's approach or your personal approach to, say they, the first time parent, their first baby cold, right? I mean, that's kind of a anticipated and necessary, but also frightening event, and maybe how you counsel your families that come to see you for, their pediatric care, but also in the book, how you address that.
Well, the first thing to know is the important stuff. So is it something that's urgent or emergent? Does your baby need to seek care right away? And so you look for things like fever. So a fever in a newborn would be really important for seeking care because that could be a sign of a serious infection or something that could spread very easily to the rest of the body. So is there a fever, and is there any respiratory distress? And that would be labored breathing, such as the fast breathing, the heavy breathing. Does your baby look like they're panting? Some parents have a pulse oximeter at home, which is a good way to measure how a baby's doing with their oxygen level. And we can teach parents how to count their baby's respiratory rate as well. So how many times is your baby breathing per minute? And anything above 60 or anything that looks super labored would be a warning sign to seek help immediately. So those are the danger
for the
signs.
newborns, right? I mean, so if and so that's until how old?
In general, for the first 2 or 3 months, a fever can be very serious.
Okay.
But up to about a year, any breathing that's faster than about 60 times a minute probably needs to be checked out.
Got it. Okay. Well, no, that's great. And so, and then what else? I mean, so say they're, have a fever, but it's not crazy high? I mean, what would be crazy high to you, or what would be
So
concerning?
a newborn, anything higher than 100.4,
Yeah.
and then under age 2, 104 is considered a warning sign, or any temperature if the baby isn't acting right. So
Yeah.
not eating, not sleeping, just lethargic, looking really sick.
Got it. So, and those are kind of like, hey, I need to seek medical care now. Say that the baby has a, is 6 months old and has a fever of 102. It's Saturday night, and has got a stuffy nose or whatever. What then? I mean, because that's really, pediatrician's office is closed. You're sitting at home. It's midnight, and then you're like looking at each other like, what do we do?
So if in doubt, I always encourage people to call their pediatrician's office. There's always somebody on call, whether that's somebody at a nurse advice line or somebody in the pediatrician's office themselves, taking call from home. In general, a lot of these things can be managed by the parents at home, so the pediatrician would tell you that. Something like a stuffy nose might be made better with a humidifier, with some saline drops, with holding the baby upright for a while with some kind of suction. And that can really help the baby be able to sleep and eat better.
Right. And so tell me a little bit more about that. I mean, obviously the sleeping and breathing part and the eating part are all kind of intertwined. So how do you kind of unpack that, or kind of what couple things need to happen for, the sleeping really is what makes people, and eating is kind of really nervous. And so, or tired or grumpy. How do you counsel people to manage that?
So if the baby is just noisy and not having any type of distress, so no laboring to breathe, no fast or heavy breathing, then you can just leave that nose alone. If they are having trouble sleeping or eating, then that's when you might need to intervene. And that's where we talk about the saline, the suctioning, and the humidifier.
Right. And so, is that, and when you're talking to those families, can they do too much suctioning? Can they do too much saline? Are there tips, tricks, et cetera, with the humidifier?
So sometimes if you do too much saline or too much suctioning, it can irritate the nose and cause it to be more swollen. And so there's usually a happy medium, no more than about 2 or 3 times a day of steady, gentle suctioning is probably totally fine.
Yeah. Okay. And what about the humidifier? Is there anything?
So humidifier works best if it is in a smaller room. So in a very wide open floor plan, for example, in the living room, it's not going to do a whole lot of good.
Right.
But in an enclosed bedroom, it can humidify the air so that it moisturizes the baby's nasal passages, and so they can breathe a little bit better.
And is there anything, like too much humidification,
I mean, too much humidification to the point where there's moisture on the walls or you're developing mold or mildew in your house isn't a good idea.
right.
You also want to make sure you're cleaning the humidifier according to the manufacturer's instructions so that you don't build up things like mold and mildew.
Right. Okay. And so, the parent brings a patient in, you as the pediatrician are seeing them, you diagnose them with an upper respiratory tract infection. Obviously, in the time of COVID, there's some other things that are kind of lurking in the back of your mind, but maybe just talk about kind of a run of the mill, upper respiratory tract infection. Is that a terrible thing? Is that an expected thing? How do you manage it, personally or in your book for, say, a 6-month-old who is in daycare and has a runny nose and a cough and a fever of 102 or something?
Yeah, so kids who are in daycare can be expected to get colds a lot, maybe once a month. So on average, maybe 8 to 10 or 12 times in a year, with each one lasting about 2 weeks at a time. And they often happen during the winter months when people are in more enclosed spaces and closer contact with each other. So it might feel like the baby has a constant cold through the winter months. If you have any suspicion that it could be an ear infection, baby's really fussy when they lie down, pulling on the ear, fever lasts longer than a couple days, then definitely get that checked out by the pediatrician. But other than that, you can expect your baby to get a lot of colds because they're building their immune systems until they're at least 2 or 3 years old.
Yeah. And so actually getting a cold isn't bad necessarily for your child because it is building your immune system. Is that?
Yeah, in a good way, it is building the immune system. For some kids who get colds over and over, then it gets a little bit more complicated. So some parents will take their kids out of daycare. Some kids need they end up getting ear tubes, for example, if they get a lot of ear infections. because the immune system is a little bit weaker before about age 2, if the kid's getting sick a lot, then it might be helpful to keep them out of daycare for a season or two, and then they'll build their immune system when their bodies are a little bit bigger and stronger.
Right. And so talk about your approach to using antibiotics in the face of colds or ear infections or what have you. I mean, obviously, as a parent of, you and I both have older kids now, but when they were younger and you were working and they were calling you constantly from daycare and, I mean, you want a solution for that. And certainly antibiotics are thought to make a lot of things better, but, how do you approach that with families to choose the right time and indications for using antibiotics?
So for the most part, common colds are caused by viruses, and an antibiotic is not going to help it. People may have said, well, every time my kid gets an antibiotic, they get better. That may just be coincidence. And we also know that too many antibiotics can cause resistance, and then antibiotics won't end up working on a child anymore. So we really are trying to balance all that out and avoid antibiotic overuse. There are certain guidelines that we take a look at for kids with ear infections, for example, and certain ages, maybe under the age of 6 months, we would be more likely to treat with an antibiotic, and then over 2 years, we may be able to wait it out and watch the child, because they're old enough then to be able to tell us, gosh, my ear doesn't hurt anymore. And they may be able to fight off that ear infection by themselves. And then around 6 months to 2 years is kind of that gray zone where, if there's a high fever, the baby's really fussy, we might err on the side of treating. Whereas if it's found on a routine checkup, we might, give something we call it a safety net prescription, where the parent might hang on to the prescription and then start it in a couple days if the baby gets worse.
Got it. Yeah. So, I mean, what are the kind of complications or things that you see for people that are on, multiple courses of antibiotics, or what, just because it seems like, my kid's sick, it's midnight, they're miserable, I want to make them feel better, but, what are the kind of the unintended consequences that you've seen that, make just giving out antibiotics all the time less of a good idea?
So in general, it can take 2 or 3 days before the antibiotic kicks in. So you're not really going to get that quick fix from it for the most part. So a parent who's trying to get their kid to be more comfortable is probably better off using a pain reliever, such as acetaminophen, which is Tylenol, or ibuprofen, which is Motrin or Advil. So you're probably not going to get a quick fix from an antibiotic. And then we can see side effects such as a skin rash or allergy that might break out, or diarrhea is a very common thing that I see in patients who take antibiotics, and stomach ache. So sometimes the side effects may cause the baby to be even more uncomfortable than, the infection itself, which could go away on its own.
Okay. And then any particular tips about when like age-wise, when you can use Tylenol versus Motrin or ibuprofen or what have you?
Yeah, so Tylenol or acetaminophen is thought to be safe to use from early infancy. So at birth if needed, but only with the recommendation of your pediatrician, because it needs to be weight-based. And we also don't want to mask a disease or illness that could potentially become more serious. So definitely talk to your pediatrician before giving acetaminophen or Tylenol in the first few months. And so that's something that we might recommend up until 6 months of age for a child who's teething, for example, or who has a mild fever and doesn't seem to be very sick. Over the age of 6 months, then ibuprofen, which is Motrin Advil, can be an option. And that's also dosed based on the child's weight. So regular doctor's visits with your pediatrician can keep you up to what can keep you updated on how much your child weighs if you don't have a scale at home.
Yeah, that's great. Then what about other medicines? I mean, certainly, when your kid and my kid were younger, I mean, there was more stuff over the counter available to manage colds, or at least we felt like that we were helping manage their colds. But really, what is over the counter now that parents can use when their kids have a upper respiratory tract infection to help manage some of their symptoms besides acetaminophen and ibuprofen?
So the safest things now would be a humidifier and suctioning and saline. We used to recommend a lot of over-the-counter decongestants and antihistamines and cough suppressants, but probably in the past almost 10 years or so, we know that the risks can outweigh the benefits. So any side effects such as, a fast heart rate or increased blood pressure, or the worst thing would be respiratory suppression or depression, which makes your child not want to breathe. Those are serious but unusual side effects, but we don't want to take a chance in young children, because under the age of 6 anyway, the medicines aren't proven to work. So there's high risks and little proven benefit. And so really we try to stay away from a lot of those over-the-counter medicines till about 6 years old.
Got it. So it's really tincture of time and supportive therapy and,
Yeah, I think if parents know that these colds can be expected to last about 2 weeks, then they know how to pace themselves so they won't get so impatient. I've seen some kids with certain viruses that'll last anywhere from 2 to 6 weeks, and it can be super miserable. But as long as they're not getting worse during that course of illness, then it's probably not turning into something more serious like an ear infection or pneumonia.
Right. Yeah, I mean, so pneumonia, I mean, obviously can be quite serious. And, what is it, that you look for or kind of counsel families to look for when, potentially there is pneumonia or something else going on?
So if a child has a persistent cough, especially one that seems to be worsening, fever that either lasts for a long time or gets worse, and any of the fast or labored breathing symptoms that you would see. So breathing more than about 60 times a minute for an infant, looking like you're panting or heaving.
Right.
The muscles in between the ribs and the chest might start sucking in and out. That's called retractions. And you might hear the child grunt a lot. So I see that in a lot of babies with distress. They'll start going, because they're trying to open up their lungs to get more oxygen in. And then the last thing to look for is nasal flaring. So all those signs would be possibilities that your child is having trouble breathing, and pneumonia is one cause of that.
Right. And so obviously if you see that, that's an emergency. You need to seek help.
Seek help right away, whether that's calling 911 or taking your baby to the emergency room or to the doctor's office right away.
Now, what do you do, or how do you counsel your family? So say they have, their child has a bad cold, kind of bad upper respiratory tract infection, they just don't want to eat, or they're just, they're having a hard time eating, et cetera. Maybe their throat is sore, maybe they're having a hard time breathing, maybe they can't breathe through their nose. So, I mean, how do you manage that, or kind of, provide guidelines about what to give them to eat, how much they should be eating, even though they're sick, et cetera?
Yeah, when kids are sick, they may not eat for various reasons. First of all, they might be so stuffed up that it's hard to coordinate breathing and eating at the same time. They may not have an appetite because nothing smells or tastes good to them. And they just might not have the energy to want to eat. So it's okay if a child doesn't want to eat for a few days. It's not okay if they don't want to drink, however. And so it's really important to make sure that the child stays hydrated. And one way to tell that is to make sure they're peeing at least every 6 to 8 hours. So if a child is peeing every 2 or 3 hours, even though it's less volume than before, the diaper's not as heavy, that's probably still okay. You can also look at their mouths to make sure the mouth is moist, and check if there are tears. But it's really important to keep them drinking, whether that be breast milk or formula or water or some type of electrolyte solution like Pedialyte. And if they won't drink a large volume at a time, give them little sips every 5 or 10 minutes to keep that trickling in. For older kids, a popsicle might help, or even like a crushed popsicle that you can spoon to them. So there are many ways to keep the child hydrated, but if you really can't get the fluids in, that child might need to go to the emergency room, get some intravenous fluids, so by IV.
Yeah, oh, that's great. One of the other things that I forgot to ask you about, what about RSV? I mean, that's something that, you hear about. Obviously, it can be quite serious. Do you have any specific recommendations or thoughts around that condition?
Yeah, RSV is a virus. It stands for respiratory syncytial virus, which I don't expect any parents to remember. And it's the cause of a common cold in most people, especially older children, let's say 2 or 3 and older. But in younger kids, under 6 months, under 2 years, it can cause something called bronchiolitis, where the smallest airways of the lungs can get blocked and filled with a little bit of fluid. So you might hear some wheezing or whistling in their lungs when they're breathing in and out. It might sound like that child has asthma. They may have rapid, heavy, labored breathing. They may be coughing a lot, and there may be a fever. And so those kids, the problem is that even though they sound like they have asthma, asthma type medicines don't typically help them get better. So if a child with RSV, bronchiolitis, is still eating well and able to stay hydrated, then a parent would probably be able to manage that at home. But if you're starting to see a fever that lasts for longer than a couple of days or gets higher and higher, if they're having any respiratory problems, then that child may need to go to the hospital, because sometimes they'll need to get some oxygen to help them through this type of condition, and some kids need some help with feeding and staying hydrated with an IV or possibly tube feeds.
Okay. So yeah, so it is a common cold that can be pretty serious. You know, and it's, you know, God forbid your kid gets admitted to the hospital. What, you know, what can you expect, or what do they typically do for those babies?
So kids who end up having to go to the hospital will be monitored, and they'll usually have some type of probe, like a little, it'll look like an elastic bandage, for example, that goes around their finger or their foot or their toes to measure their oxygen levels. And if it goes low, then those kids may need to get some oxygen, and that might look like a face mask or a hood that goes over their crib, or a little nasal cannula, which is a little tubing in the nose. So some kids need a little extra oxygen if they have the RSV bronchiolitis and need to get hospitalized.
Got it. I mean, obviously, you know, we're in the time of COVID-19, and you know, it's, you know, thankfully less frequent in children. But you know, are you, as a pediatrician or your office, kind of looking at how you're going to assess these, you know, common colds in children as, you know, we kind of work through the COVID-19 crisis?
Yeah, it's definitely a challenge to have COVID-19 along with common colds and flu once it's flu season. So with people being separated now that a lot of daycares and schools are closed, we're not seeing as much illness in the office right now, but I know that that will definitely pick up once the weather changes and people are exposed to one another a little bit more. In general, common cold will be kind of like low level symptoms for 1 or 2 weeks and then go away. Something like the flu, you'll have a sudden fever, and that can last maybe a week and go away. And then with COVID-19 in kids, we don't see it as much as with adults, which is wonderful. But babies under a year and anybody with, you know, certain medical conditions who put them already at risk from especially a respiratory standpoint could get sick more quickly and more seriously than, you know, typical kids without any medical problems. So I really do have an eye out for kids under 1 year old, especially.